Beginning of the exam. Please go around to the station. Enter the station.
Good morning, teacher. Good morning. Please come in. Yes. Okay, please, you can read your task. You have 1 minute for this. Thank you.
Begin to complete the task.
Please start to complete the task.
Hello, I'm your family doctor and now I'm going to check the presence of the meningeal signs in your baby. Don't you mind, please? Thank you. So, we start with the first sign that is called nuchal rigidity or neck stiffness. For that, we place our dominant hand on the chest and left hand supports the head of the baby. Now try and bend chin to chest, flexing the baby's neck. This flexion can be easily done and it's painless. I feel no resistance with my left hand, so the sign is negative. Second sign is called upper Brudzinski sign or neck Brudzinski sign. We start the same, the initial position is the same, placing dominant hand on the chest, supporting the baby's head, bending chin to chest and looking on the lower extremities of the baby. They are not flexing, so this sign is negative. Middle Brudzinski sign or pubic sign. With the border of the right arm, we press on the pubic area, looking on the knees of baby. They are not flexing, so the sign is negative. Lower Brudzinski sign or leg Brudzinski sign. One leg should be flexed both in hip and knee joint, looking on the other extremity. It is lying without flexion, so it remains extended, means the symptom is negative. And the last one is a Kernick sign. To check that, you have to support the baby's heel and knee, flexing his knee and hip joint. This is initial position, and then trying to extend the leg in the knee joint. As we can see, the extension can be easily done. It's free and it's painless. So the symptom is negative. So the conclusion is that your baby has no symptoms of meningeal irritation.
1 minute left.
Okay, thank you. Okay, thank you. Please take your list and go to another
Finish the
patient.
task
Thank you,
and
teacher.
move to the
Bye.
next station. Beginning of the exam. Please go around to the station.
Please
Enter the station.
So let me see your sheet. Okay. There is a task, please. You have 1 minute to read.
Begin to complete the task.
You're a doctor of admission department. A 7-year-old child was brought to you after eating unknown berries. He is suffering from the following disorders: visual disturbance, disturbance of accommodation and photophobia, constipation, full bladder and fever. Within the next 5 minutes, please point out the substance that could cause the poison, drug group, and as well as the antidote with description of antidote group name, its mechanism of action, other indications for use, and common side effects.
Okay.
Can I start?
Yes, please.
So poison was caused by atropine, this is M-choline blocker. Antidote group, it's M-choline mimetic, for example, physostigmine or prozerine or galantamine. Mechanism of action, this is reversible inhibition of acetylcholinesterase and accumulation of acetylcholine in synaptic cleft. In other indications, for example, can be glaucoma, atony of urinary bladder or GIT, myasthenia, paralysis, and poisoning of M-cholinergic blockers and decolorization. Negative effects can be hypertension, bradycardia, bronchospasm, diarrhea, increased
1 minute left.
glands, and convulsions.
Okay, that's all. Thank you. Thank you for your answer.
Finish the task and move to the next station. Beginning of the exam. Please go around to the station. Enter the station.
Good morning, teacher.
Good morning. Come in, please.
Thank you. Here's my route sheet.
Yes, please sit and read your task. You have 1 minute.
Begin to complete the task.
Good morning. I'm your family doctor and now I'm going to assess your baby's physical development.
Please do.
The boy is 7 months old and first of all we take the chart for the indicating length to age. As I already said, he is 7 months old and his current length is 71 centimeters. So 7, I put the dot on the cross of 2 lines, indicating age of the child in months, 7 months, and length of the baby in centimeters, 71 centimeter. Here it is. The point is in the track between 0 and second standard deviation. Next step, I'm connecting the curve indicating baby's growth parameters to the point. Next step, I will take the chart for weight. Baby is 9 kgs now, so his age is 7 months, his weight is 9 kgs. The point on the cross of 2 lines indicating age and weight. Point lies in the track between 0 and second standard deviation as well. Now we connect the curve indicating baby's weight gain to the point that we get. And third chart indicating baby's body mass index. Before we apply that, we have to calculate the BMI. We have a formula for calculation. It is weight of the baby in kgs divided by the square meters of height. So, his weight is 9 kgs dividing to 0.71 and again divide by 0.71. We got 17.85, so it is equal to 18. So his BMI is 18. As we've calculated, BMI is 18, equal to 18, his age is 7 months, so the point indicating his BMI is in between 0 and first standard deviation. Again, connecting the curve to the point. And the last step that we have to do is to fill the chart to make the conclusion about the baby's physical development. So, length to age. The point was in the track between 0 and 2, so it's normal. Weight to age, the same between 0 and 2, it's normal. And baby's BMI, the line is in between 0 and first standard deviation, it's also normal. So the conclusion sounds like that the baby's physical development is
1 minute
appropriate
left.
for his age, according to the standard deviation charts.
Thank you. Please take your list and go to the next step.
Thank you.
Finish the task and move to the next station. Beginning of the exam. Please go around to the station. Enter the station.
Thank you. Good morning. This is my course list.
I'm checking your number of your course list, it's correct. And you may read your task
Thank you.
and prepare for
Begin to complete the task.
Okay. Can I begin the practical?
yeah, you may begin.
Thank you.
Sorry for disturbing. Good end. Emergency.
Sit down in the chair.
Oh, thank you very much.
Good morning. My name is Ekaterina Sergeyevna. I'm your doctor. And
Nice to meet you, ma'am.
Nice to meet you. I will perform the examination. And do you agree?
Yeah, sure, ma'am.
We begin from the inquiry, from questioning. Please say me, what's your name?
My name is Andrew.
How old are you?
I'm 31.
What is your profession?
I'm an engineer.
Engineer. Andrew, sorry, please say me, what about your complaints? What happened with you?
I don't know exactly what I have, but I have some troubles with my health. It's I understand exactly that's why I came. You know, I have difficulties with breathing. And you see that these difficulties, they're growing up. Now I have this pain on the left side, pain in the chest on the left side, and it's getting me nervous. I don't know what to do.
What about the difficult breathing? Yes, breathlessness. Please say me, more difficult inhale or exhale?
It's difficult for me to understand, or it's inhale, but I think after a cough I experience these symptoms mostly. I think it's during inhalation.
Inhalation, okay. What about the cough? Dry or productive?
My cough of the last few days, it's moistened. Mostly it's moistened, but before it was dry.
Dry, before it was dry. Okay, you said that you had chest pain, yes?
Yes,
chest
sure.
pain. Show me exactly the place of
It's
this pain.
mostly left region of my chest. You know, it's not a heart pain or it's not a stomach pain, just like here on the left side.
Is it depend on physical activity?
Mostly not, but for you I can say that before it was easy for me to run for a few blocks around the park a lot. I ran each every day for 5-6 kilometers, but now for me it's even difficult to walk a block.
Even ordinary exercise, yes?
Yes.
Okay. What about the body temperature? Did you measure?
But yeah, I'm measuring it, my body temperature is often normal, but in the evening I could say that it's rising about to 38.6, 38.7
It's
degrees
maximum.
Celsius.
It was maximum.
Yeah, it's maximum.
Yes.
Maximum.
Maybe another complaints, maybe another problems.
Another complaints, I think no, maybe this general fatigue, I'm irresponsible to do something, and that's what I spoke just few words and I feel
Even-
these difficulties with breathing.
Even
Yeah.
now, yes. Okay, what about the beginning? How many days ago it began?
It started, I think, five days ago. Yeah, I think that it started due to I catch cold. Really, I was getting out from the gym. I was warm, very warm. I was hot. I get out to the street and I catch a cold there because it was windy weather there.
So during these 5 days, yes, did you take any medications, any treatment?
I tried. I took a medication of paracetamol orally, 1 tablet per day, due to my temperature. Mostly it was
How many
daily.
times did you take?
One time.
One
One
time.
time only with my temperature.
What about the previous contact? So did you have the contact with person with similar symptoms?
No, I haven't.
No. What about the bad habits?
What do you mean, please? Explain.
Smoking,
No. I'm not smoking. I'm not
Alcohol,
consuming alcohol. Nothing.
Okay. What about the allergy?
Allergies? No.
Medications,
I can't remember any.
plants,
No.
different food. No, yes, no information. Okay. So, Andrew, what you can say? I can say that probably based on the inquiry, you have the symptoms of inflammation of pleura, pleuritis, yes, but
1
you need,
minute left.
additional diagnostic, and I will prescribe everything you need. Thank you very much.
Thank you, ma'am.
Goodbye.
Thank you. Good luck.
Well, you finished your examination. Now you may take your
Finish the task and move to the next station.
Thank you very much. Good luck. Thank you.
Beginning of the exam. Please go around to the station. Enter the station.
Yes, you may. Come in, please.
Thank you. Good afternoon. This is my course list.
We are checking the number of course list. Number is correct, and the teacher is signed. And you may read your task.
Thank you very much.
Begin to complete the task.
Okay, can I perform the practical skill? Yeah, you can. Yes, thank you very much. I should perform the auscultation of the lungs. So first of all, I should say the patient hello. Introduce myself. I'm the doctor. My name is Ekaterina Sergeyevna, and I will perform the auscultation of your lungs for correct diagnosis and prescription of correct treatment. What is your name? So I should ask the patient to introduce himself, explain about the procedure. It is absolutely safe and absolutely non-painful manipulation. I will do it with stethoscope. Do you agree with it? It is very important to take the informed agreement from the patient orally. I must provide for the patient the comfortable position. It can be standing position or sitting position. I must ask the patient about his feeling, about his condition. How do you feel? Everything is okay? I should ask the patient to release his chest from the clothes for performing of auscultation. I must check the correct position of the patient. In this case, it is standing position. And for the beginning of auscultation, his hands should be along the trunk, should be held along the trunk. I should check the working condition of my stethoscope. It is basic equipment for auscultation of the lung. I should take the antiseptic wipe and moisture, the membrane of stethoscope and ear tips. I should ask the patient to breathe smoothly through nose of the medium depth. After this, I should put on the rubber gloves, my hands with antiseptic, take my phenendoscope, stand near the patients. It can be in front of the patients and can be on the right side of the patients. Put the ear tips in my ears. Begin the performing of auscultation. We begin from the supraclavicular fossa on the right side and on the left side. We should put the membrane of stethoscope strictly on the skin and wait for 3-4 seconds, minimum 1 breathing cycle. So 1 inhalation, 1 exhalation, and ask the patient breathe through nose. So please inhale, exhale, inhale, exhale. So we should compare the symmetric points. After this, subclavicular regions, the first intercostal space, linea media clavicularis, dextra and sinistra. Inhale, exhale, inhale, exhale. Second intercostal space. Inhale, exhale, inhale, exhale. Third intercostal space. Inhale, exhale, inhale, exhale. After the third intercostal space, we should continue auscultation only on the right side, because on the left side we have the patient has heart. So, fourth intercostal space, inhale, exhale, and fifth intercostal space, inhale, exhale. After this, we should ask the patient lift his hands and put the palms on the back surface of the neck to make the axillary region free for further auscultation. So we begin from the lower edge of the axillary fossa on the both sides. We always compare symmetric points. Linea axillaris media. So please inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale, inhale, exhale. Okay, you can return your hands in ordinary position. After this, the doctor should stand behind the patient. The doctor should stand behind the patient and continue auscultation from the posterior surface. We begin from the top of the lungs, suprascapular region, symmetric points, the same. Please inhale, exhale, inhale, exhale. After this, we should ask the patient to cross his hands on the chest to make the interscapular region more wide. Inhale, exhale, inhale, exhale. It is upper part of interscapular region, middle part the same. Inhale, exhale, inhale, exhale, and lower part of interscapular region. Inhale, exhale. After this, we should continue under the angle of scapula, 8th intercostal space on the both sides, and 9th intercostal space of the both sides. After this, we inform the patient that manipulation is end. Thank you very much. You can put on your clothes. You have some changes inside your lungs. It is very useful for our
1 minute left.
further actions. Thank you very much. And after the manipulation, I should moisten my hands with antiseptics and put off the rubber gloves.
You may take your constitution and you might
Finish the task and move to the next station.
Thank you very much. Good luck. Goodbye.
Beginning of the exam. Please go around to the station. Enter the station.
Good afternoon. Good afternoon. Can you come in?
Yes, of course, you may. Thank you. It's numbers.
Begin to complete the task.
This is hypoxia. I think hypoxic hypoxia, classification hypoxia, many types, endogenic and exogenic. Exogenic, 2 types. When atmosphere pressure is normal, and when pressure decrease, it's hypoxia. Another, it's according to disturbance of respiratory system, respiratory hypoxia, then circulation hypoxia, then disturbance of hemoglobin, hemolytic hypoxia, tissue hypoxia, mixed hypoxia, and hypoxia of load. In this situation, saturation of oxygen decrease, and I think that it's alkalosis. When saturation decrease and pressure of carbon-oxygen decrease, then 35. I think that as compensation mechanism is increase minute volume of respiratory ventilation, increase level of blood, and according to this, some problem with all part of this organism, and it's the main pathogenesis link. If you have questions to me.
I have a question to you, and maybe you want to tell me more about this topic.
This topic, okay.
First of all, I'm thinking about question about classification and how many kind of hypoxia you know.
I know, for example, local hypoxia and total hypoxia. According to problem, it's
1 minute
more
left.
mild hypoxia, middle level, severe, and dangerous hypoxia.
Okay, thank you very much. You can go to the next station. You're welcome.
Finish the task and move to the next station. Beginning of the exam. Please go around to the station. Enter the station.
Hello, may I come in?
Hello, students. Please sit down, read the test.
Begin to complete the task.
May I start to answer?
Yes?
Determination of blood group. First of all, we need to use gloves.
Well,
Дайте команду или можно? To determine blood group, we use tablets, we use blood of patient, we use Solicon anti-A, anti-B. Also we use pipette and we use glass stick. First of all, we take blood of patient, special place. Then we take blood of patient and put place A and B. Then we use anti-A. Place A, anti-B, place B. Then we take glass stick and start to mix this one side, other place, other side of stick. Then we mix again and we are waiting for 3-5 minutes. We use blood and soliclone in concentration 1 to 10.
thanks.
1 minute left.
What blood group is it?
This is blood group A.
Please write it.
I have. Thank you.
Okay, then please.
Finish the task and move to the next station. Beginning of the exam. Please go around to the station. Enter the station.
Good day. Sit down, please.
Begin to complete the task.
This is a microscopic preparation of tissue of liver, the epithelial cells, stained with hematoxylin and eosin. Typical staining we can use in microscopic preparations in most pathologies. And this is a fragment of the liver. It has some pathological changes. We can see changes in the hepatocytes. We can see large, small, empty spaces. They are vacuoles. They are filled with some transparent substance not stained with hematoxylin and eosin. And the patient, he had been using alcohol for 20 years. The liver was enlarged, yellow, homogeneous and soft consistence, and it is all typical for fat dystrophy. In fat dystrophy we see accumulation of fat which is transparent in hematoxylin and eosin. We can use specific staining, we can use Sudan for fat to prove that this is fat dystrophy. Here we can only see the empty vacuoles because of staining. And we can also see signs of alcoholism. We can see purple nuclei, we can see pink cytoplasm and pinkish reddish granules in the cytoplasm hepatocytes. This is hyaline accumulation. This is protein dystrophy. Alcoholic hyaline accumulating because of alcoholism. So this is
1 minute left.
But most importantly, this is fat dystrophy of the liver caused by alcoholism.
Finish the task and move to the next station.
Thank you, goodbye.
Beginning of the exam. Please go around to the station. Enter the station.
Hello, may I
Hello,
come in?
student.
May I come in?
Come in.
Traffic list.
Please sit down, read the text.
Thank you.
Begin to complete the task.
My task.
Yes.
My task is stop external bleeding. First of all, we use gloves. After that, we use antiseptic. My name is Dr. Koltvin. I'm going to stop your external bleeding. First of all, I take patient's leg and put it in a pillow to make it more higher position. Then we use sterile napkin and sterile roller. All time I'm looking for patient's face and ask how patient feel. Then I take bandage sterile and start to make circulation moving. First of all, 2 circulations moving. And then we can use breast circulation moving. Whole time I'm looking for patient's face and ask how patients feel. Are you okay? I finish with 2 circulations moving. Then we take scissors and cut. At last we need to cut such moving and make last model.
One minute left.
How it feel? Everything is good. We stop bleeding. Thank you. I'm finishing.
Thanks, do this, please.
Finish the task and move to the next station.
Goodbye.
Goodbye.
Beginning of the exam. Please go around to the station. Enter the station.
Nice to see you. Thank you. Okay, please.
Begin to complete the task.
I'm a family doctor in an outpatient department. A 65 years old patient came to you with complaints of prolonged abdominal discomfort, poor appetite, and sweating and flatulence. You decided to prescribe Bisacodil to the patient. Please, within the next 5 minutes, indicate the drug group, its mechanism of action, indications for use, side effects. Prescribe the drug in the form of a prescription and indicate the existing form of this drug.
Okay, if you're ready, so please.
Thank you. So Bisacodil, this is laxatives, moderate laxatives. Mechanism of action, this is stimulation chemoreceptors in the colon and delay absorption of the water and electrolytes in the colon. Indications, it can be constipation, hemorrhoid, anal fissure, and preparing to the diagnostic procedures before surgery. Side effects, it can be development to tolerance, allergic reactions like itching and abdominal pain.
Please write down prescription.
Thank you. I will start with recipe after drug form Dragi 0.005, number 30. Disigna, take 1 Dragi before sleep. And
1 minute left.
Tablets, Dragi, and suppositoriums.
Thank you. Can I see your prescription?
Yes, of course.
Okay, so let's look.
Thank you.
Finish the task and move to the next station.
Good luck.
Thank you.
Bye.
Beginning of the exam. Please go around to the station. Enter the station.
Good day, teacher.
Good day.
Begin to complete the task.
This is micro preparation, yes? I wash hands, I put on gloves, I look at the preparation. This is part of kidney, teacher. The surface is smooth, is glistening, is grey color, pale grey color, and smooth surface. And section also grey color, and also glistening. And with the scale, we measure size. Size 10 by 6 by 3, the size of the half of kidney. And on section parenchyma of kidney. 5 centimeters and a half by 2 centimeters this size. What else? No border between cortical metal and layer. So dense, very dense, or gray color. Amyloidosis. Amyloidosis of kidney, protein dystrophy, because of tuberculosis. Amyloidosis.
1 minute left.
Okay, I finish. I take off gloves and wash hands. We go next station. Thank you, teacher.
Finish the task and move to the next station. Beginning of the exam. Please go around to the station. Enter the station.
Come in, please. Thank you. Please, your pathological task, you can prepare during 1 minute, and after that, please answer me.
Begin to complete the task.
Can I answer?
Yes, of course. You can start.
According to this task, this 43 years old patient who suffered from disturbance of thyroid glands, it was cancer. I think that with this cancer lose not only thyroid glands and parathyroid glands. So it is disturbance of thyroid and parathyroid glands hypofunction. So it's increased level of phosphate and decreased level of calcium, hypocalcemia, lack of parathyroid hormones. As a result, it's tonic cramps, tetany, coma, and so disturbance function as thyroid glands and parathyroid glands. And so we must advise this patient group of drugs with calcium. And as a result is absence of parathyroid hormones, parathormones in blood, hypocalcemia, decreased reabsorption of calcium in the kidneys, maybe osteoporosis because decreased calcium in cells and bone, and lack of function of actions and myosin fibers. So the main function of calcium is take part in mechanism of construction of actin and myosin fibers.
1 minute left.
The main.
Okay, thank you. That's all?
If you have questions.
No, I have no question, so I put my signature. We can go to the next station. Good luck.
Finish the task and move to the next station.